says I'm live on Facebook. Have I pressed the wrong button? Quite possibly. I wouldn't put it past myself that I've either pressed the wrong button or not pressed the right button. Either of those are very real, potential. Am I on Facebook? Am I live on Facebook? I know I can go on. Anyway, it doesn't matter, does it? Does it matter? I can go on Facebook myself. Anyway, never mind. I'm on Facebook now, am I? Oh, it's on Facebook. Okay, good. Yes, on Facebook. Okay, good. Right. Oh, yeah. Where's my picture of a hand? So there's a picture of a hand somewhere here. So this patient thought I was misleading them. Oh, God. No. Oh, where's it gone? So the thing about there's tattoos on the back of the hand, what I normally say to people is if you can pinch it, if you've got a tattoo, if you can pinch it, then we might be able to remove it. If you can, wherever it is, your face, but you can pinch it, then that gives us an idea of how much laxity. And what happens on the hand? People often pinch their hand and say, "Look at that! I've got a big. I can take it off." Big, because often people have them here. The problem with the hand is if you pinch it. Yes, you might be able to take that skin pinch, but the reason there's laxity on the hand is because you've got to make a fist. So if you pinch it and take a load of skin off the fat back of the hand, and then you go home and you make a fist, there's no longer any laxity once you made a fist. So that is a bit of an issue if you've got a tattoo on the back of the hand. So the back of the hand, I'm now on Facebook. Right. Okay. Sorry about that. I don't know what happened there. And technical department, as per usual. So the back of the hand is not a good place. There's loads of places that are not good places for tattoo excision. Back of the hand is not good. Shoulder is not good. So I don't want to mislead anyone by saying, oh, we can do tattoo excision, because we can do tattoo excision. We can take some quite big tattoos off. But, send us your photo. And if it's not suitable, then I will tell you. And I'm sorry that the back of the hand one was not a suitable one, and I didn't mean to mislead, and I gain nothing by misleading anyone, because it's not like I'm, you don't pay to send us a photo. It's all gratis, free. Jay says the back of my hand is slightly smaller. Yeah, I mean, Jay, that one is a massive one, even a smaller one, because often you get those little ones here. Are not good. The back of the hand is just not good, because even if you feel like you've got laxity, it goes when you make a fist. So every time you make a fist, it's not going to be good. So I don't know what the orientation, because the other thing is the orientation when you look at tattoos. So ideally you want it orientated this way, because you want to make the scar like that, so that when you make a fist, it's not giving tension on it. If you make a scar like this and you make a fist, that can pull the scar open. So you want a scar to go in sort of in the line with your tendons. But the back of the hand, the back of the finger, even a very small tattoo on the finger is very hard to remove, and it's not a good place for a tattoo. Yes, I will, Jay. Will I look at your tattoo? How can I do that, Jay? You can email it to me. Can you somehow? I don't know, Jay. Is there some way you can show me a tattoo? By all means, yeah. This is gold. I mean, this is the reason why YouTube wanted me. Because this sort of interaction is gold. So Jay, how can you show me a tattoo? I've had laser and it's faded plenty, but not exactly happy. Oh, I understand what you're saying. Yeah, Jay, if you email me, I can show it to the people at home, or I don't know, some other way of doing it. I don't know if there's some way. Didn't mean to be rude. I don't think you're being rude. No, not rude. So if you email me, I will check it out while we're going. And yeah, so it depends on the size and the location. So size, because I've just got another one, and in fact he's just emailed me back just now. Someone who can't be on this because he said he's working, but he just emailed me anyway. Very large tattoo on his abdomen, but it's huge, absolutely huge. And it's just too big. It's just too big to remove by excision. So yeah, size and location. Those are the two important things for tattoo removal, and they're both important. A big tattoo on a good location is potentially a goer. So it's not just size. And a small tattoo in a bad location is a potentially no-goer. So size and location, which is why you have to send us a photo. My hand hurts now. I've been pinching it too much. So it's why you have to send us a photo. So I can't really say to you, a size of a 50p piece is going to be okay sort of thing, because it depends on the location. And the other thing is, if it is big, what we sometimes do is we do what's called a serial excision, where we take a piece of it away, and then we take another piece of it away and another piece of it away. But that can make it quite a few sessions. So sometimes we can do that for a larger tattoo, but some tattoos are just a no-no. And I'm afraid this hand is a no-no. It is too big to be removed by excision. But by all means, Jay, send us your photo, or if you can somehow get it to me in some technological way, I would love to see it. I've been neglecting the chat. I've got a question. Oh, they've done that virtual consultation. How long after mini tummy tuck, breast lift, and augmentation, blimey, can I fly abroad? Right. Wow. First thing, Natty Run Z, is to talk to your surgeon. Yeah, talk to your surgeon, because your surgeon's always best placed to answer questions like this. But in general terms, after a mini tummy tuck, breast lift, and augmentation. Okay, so the breast lift and augmentation, I always say to people, is a big deal. Mini tummy tuck is a relative, but breast lift and implants, you can't mess about. It's tight. It's mini tummy tuck's going to be tight. It's all going to be tight, isn't it? It's tight surgery. It's uncomfortable. The thing I say to people is, why are you flying abroad? If you have to fly abroad, if someone's ill in your family, or there's some reason you have to fly abroad, you can fly abroad. They're not going to stop you at the gate and say, hold on a minute, what's that dressing you got on your breast? Have you just had surgery? They're not going to stop you. You're just going to walk straight through. So you can fly abroad whenever, but there are a couple of things. First of all, DVT, PE, clots in your legs, fly off into your lungs. Flying is a risk of this. Surgery is a risk for this, because you're immobile during the surgery. So you don't want to multiply up your risks. So you want to give it, I'd say at least 6 weeks for that. Also, you got to think you're going to be uncomfortable. It's going to be hard to lift bags. So if you're going for a holiday, say, it's going to ruin the holiday a bit if you go in the first couple of months. So I would say give it, say, minimum like 2 months, maybe 3 months, and then around 2-3 months, things are starting to settle. Your scars will probably be a bit red, but you can probably hide them if you're going in the sun. You still feel fragile, but yeah, 2 or 3 months, I would say, but to be comfortable. But if you're asking when can I fly abroad, there's no rule or no law about it. You can fly whenever you want. Jay, looking out for your email. info@staianoplasticsurgery.co.uk, by the way. info@staianoplasticsurgery, STAIANO, plastic surgery.co.uk. Emma Victoria, my implants are 11 years old. Think I will need lift with augmentation. Is this much more complicated than an augmentation alone? Easy for me to say. Yes, it is, Emma. Yeah, basically. So it's a couple of things. It's more complicated. It's more scarring, which I'm not sure if you're aware of this, Emma, but it is more scarring. When you do a lift, when you do an implant only, you probably got a scar in the fold. When you combine it with a lift, then it's scarring on the front. And a lift with implants is a relatively big deal, because it is lifts tightening the skin, implants are tightening the skin. So it has got a relatively high complication rate when compared with other types of cosmetic breast surgery. And so many surgeons don't do it, Emma. Many surgeons will not do a lift with implants. They will stage it. They will do one and then do the other. I do it, and but I warn everyone it's got a high complication rate. And in terms of complications, that means if you have a problem with the wound healing, if the wound's so tight and the wound breaks down, if you get any infection, if infection gets to the implant, you have to remove the implant, let it settle, then put another one back in again. So that's a big deal. So yes, having a lift with the augmentation is a big deal. And so basically, if you, I mean, what a lift does is it tightens the skin. So there's essentially two ways of tightening the skin, which is to do a lift, as previously noted, or an implant. An implant can sort of tighten the skin. So it depends on how much skin you've got, how much droop you've got. So if you've got a significant droop, you might need an implant. Sorry, you might need a lift. But if you haven't got a significant droop, then you can use implants to tighten the skin to a degree. It doesn't lift the nipples, so the shape's never as good as when you do a lift. But that's one thing to think of. I don't know what your circumstances are. If you've lost weight, if you've had children, those things will stretch your skin and give you more of a droop and make you need a lift more. But this is something we could chat about. Maybe take it offline. Chat about if you wanted to. Oh, hold on a minute. There's more to this question than meets the eye. It hasn't come up. I'll need a lift. Sorry, my implants are 11 years old. I think I will need a lift with augmentation. Is this much more complicated than augmentation alone? And is it normal to need lift when replacing implants? I wouldn't say it's normal, Emma. It obviously, by definition, not by definition, but often a long period of time has passed between your first surgery and the second surgery. So during that period of time, you've been acted on by gravity, as are we all, and things may have happened in your life, particularly weight loss in children, which may cause your breast to stretch and droop. The other thing to consider is what you want to do in terms of size. So particularly if you want to downsize your implants, then that's going to create more spare skin and increase your need for a lift. If you want to upsize your implants, you might be able to take some of the slack skin up. Or if you want to stay about the same, then maybe just due to normal life events, then it could droop. But I wouldn't say it's normal to need a lift when replacing implants, not least because often people who have implants in the first place have got smaller breasts. And the breast is the thing that's acted on by gravity. So if you've got a smaller breast, then there's less breast tissue to be acted on by gravity. So you're less likely to need a lift. So I wouldn't say it's necessarily more common to need a lift when replacing implants. It can be the case that some people just want the implants replaced and you don't do a lift, you just replace the implants. But if you're not happy with the shape, then replacing the implants would be an option. So yes, if you want to, we're doing virtual consultations, Emma, you can book them online or give us a ring if you want to book that. That would be fine, and it would be nice to go talk to you about this sort of thing. So feel free to book it through the website or Facebook. Actually, there's a tab, I believe, on Facebook you can book it. I have reason to believe. Done the hand tattoo. Oh, speaking of virtual consultations, do I need to show my tummy on the virtual consultation? No. Do you know what? I don't examine you at all on the virtual consultation. It doesn't feel right. It just feels a bit odd, and it doesn't. Just on several levels, it's not right. So no, don't worry. I won't ask you to do anything like that on the virtual consultation. Obviously, if you've got a mole or something on your face or a scar, then I will look at it. But if it's something on your body, I just think it's nicer to either send us a photo if you want, or if you feel comfortable with that, or I'll just see you in real life in the clinic. Because I probably need to examine you. Certainly in this case, with the tummy tuck, you need to examine patients, check out the integrity of the muscles, and see how much laxity there is. So yeah, it usually comes to the fact that we're going to have to examine you at some point. So no, don't do any sort of examination or intimate thing on the virtual consultations. That's me personally. I don't know what other people do, but don't worry, you will not be asked to show any part of your body on the virtual consultation. It'll literally be a chat and me showing you photographs, and that's as far as it goes. If you have something that needs to be seen, you can send a photo to me, or I can examine you when you come to the clinic, and there's chaperone there, and all the right environment to do that sort of thing. So Stevie's come in with okay, let's do Stevie, because Stevie's there. Can I have my nipples moved slightly higher without a breast lift? Yes, you can, Stevie. So there's a couple of ways of doing it. You can do and of course high. You can do what's called a crescent. Well, still called a lift because it's lifting the nipple. So basically, you've got a nipple here. What you got to think of is, I mean, it's not easy, Stevie. It is not easy because if you do a crescent lift, you just take a crescent of skin above the nipple and just lift it up a bit. Now that has a potential to elongate the nipple because you've just taken asymmetrically some skin above it to lift it. There's a risk that skin that's going to be under tension, the scar can stretch. The other thing is you can take a donut of skin all the way around, again asymmetrical, so like an ovoid of skin, so you cut around your nipple and then an ovoid, so try and lift it up. The problem is if you do that, if you take an ovoid of skin and then cut around the nipple and move it up, the ovoid is bigger because you've cut around the nipple and then done. I need like a whiteboard, don't I? Do you follow me? You following me? I'm making. So, all right, these are my notes. Don't really want to. Basically, if you've got a nipple, so you've got a nipple, that's a breast, that's a nipple there, and you want it to be higher. So that's your nipple now, and you want it to be higher, you want it to be up there, right? So what you can do is you can cut round your nipple. You see that? So you cut around your nipple, so a circle, and then you cut like an eccentric circle, so like an ovoid shape. So you're cutting more skin above the nipple. That dotted line is another cut line. So then you're left with. Then you move your nipple up. So you move your nipple up into the space. Right, you moved your nipple up into the space. Where is it? Here. So the nipple's moved up, but so your nipple's moved from that. You've moved it up into the space, and then you got a wound, a hole, or a bit of skin below. But then you got a bigger circle. You got this ovoid circle, and you got the small circle around the areola that you got to do something with. So what do you do? So you've got two options. Option one, option two. So one option is to stitch around the areola. So option one is to stitch around the areola, and then you're going to have excess skin because you've got this bit of skin below it. Got that bit of the skin below. So you can have excess skin. So you can stitch it down as a straight line, but that'll look a bit weird. That'll be like a circle with a straight line on it. It'll look a bit weird. You'll have a dog ear there. So the other option, I've tried to demonstrate that sort of wrinkly skin. So you've stitched a bigger circle into the smaller circle, and it's all wrinkly. So so it gives you like a wrinkly scar. So it is an option to bottom line. I don't know how much you want to know. You probably didn't want to know all that, did you? Anyway, it is an option to move a nipple basically slightly higher without a breast lift. It's not easy. The scar, my preference would be to do the wrinkly scar rather than having a little straight line, because the straight line you'll have a dog ear and it'll be pleated up. So yeah, it is an option basically, but your scar will be a bit bumpy, a bit like an areola reduction scar, and then it'll settle over time. And you've got to be careful not to go too high. Too high, bad news. So, but yeah, usually you do a breast lift, which will be similar, just a bit more than that. But yeah, that's an option. Yeah, I'm not sure how did that go with the with the pictures. Of course, hi. Stevie's following. Good. What sort of cost would that be? Stevie, call me or message me. Can you message me to remind me to send you a message? I don't know. I'll get the people in the office to do something. I'm making a note here. Making a note, Stevie. I'll try and get them. I'll just want to keep the note there with my good picture there. Mia is in the house. Big up yourself, Mia. How you doing? Hi, Jonathan. My minor op is now in August, and I'm very, very relieved as it means I've got a lot more time to heal before I'm back at university. I just want to say thank you to everyone at the clinic for always being so helpful and caring. You really do offer a first-class service. That is the sort of comments we want. I should show you on Instagram, people. That's what we're talking about. First-class service. Yeah. Her words, not mine. Thank you, Mia. First-class patient, if you don't mind me saying. Very kind of you. Very kind of you to say. Stevie, no, I did. That was perfect. Thank you. I understand what you mean, like puckering. Exactly. It's something I'm definitely considering depending on cost. Yeah. Okay. Send if you can remind me, Stevie, in an email, but I will try and not make you remind me. I will try and remember and email you or message you on Facebook or do whatever we can do. Get someone in the office to do that. Bumpy Girl's here. Hello, Bumpy. How are you? I'm very well, thank you myself. And I hope you're well too. So thank you. Yeah, we've got some good questions there, haven't we? So what's next? Oh, that's weird. I've got an areola reduction question. That's weird, Stevie. So yeah, well, do I need an areola reduction? Wow. Okay. Right. So this is a patient who has come to the clinic, and basically one of the things about areola reduction is that the scar, if your areola is quite pale and quite similar in color to your skin, the scar from an areola reduction, which goes all the way around the areola, by the way, is the bit of pink bit around the nipple. The nipple's a bit that sticks out, and the areola is the pink circle around the nipple. If your skin is quite pale and your areola is quite pale, that scar can be a bit more obvious. There can be a line around your areola. If your areola is quite dark and the skin, and there's quite a demarcation between the color of your areola and the color of your normal skin, it's easier to hide that scar. So the scar can be a bit obvious. And so I basically tell everybody this. And so sometimes people, well, do I need it? I'm like, it's a bit like, well, it's a bit like anything that I do. You know, do you need it? It's like, well, it's up to you, really. There's no one saying this is pathological, this needs to be done. No GP is going to look at your areola and think, oh my God, we've got to rush her into hospital. You know, I mean, when we mark areola, when we're doing a breast reduction or a breast lift, then an areola reduction is part of that. We normally mark it about 4 centimeters, give or take. And so sometimes it's 5-6 centimeters. So it's marginally larger than what we would mark it at. But do you need an area? I don't think anyone needs an areola reduction, and it's a very personal thing, and it depends on you and depends on whether you're happy to accept the scarring, because that's the main thing. And the scarring is puckered, just like we were saying about that. It's puckered up and then it settles over time. So it's up to you. No one needs it. No one needs it. But if you want your areola to be smaller, it is possible, but you have to accept the scar, which might be more obvious if your areola is pale and will be initially puckered and then settle over time. Sad Vigilante. Oh. Can you remove a fibrous papule with electrosurgery? Whoa, electrosurgery. Blimey, electrosurgery. That sounds flip. Fibrous. What do you mean by electrosurgery, Sad Vigilante? I mean, we have got a thing called a diathermy, which passes an electrical current through. We use it on forceps. You can use it on a metal thing, which is a sort of like a blade, which you can cut things with, and that would be possible to remove it with that. But yes, is the answer. I'm not sure if there's a contents to the question. I would personally, I would use a knife to cut it off, and then I would use the electrosurgery, the electrical current, to burn it. Similarly with laser. Yeah, laser. So laser burns it basically. So electrosurgery will burn the tissues. But yeah, you can, and you can use an ablative laser, something like a CO2 laser, to cut things off, to cut lesions off, and that would be possible. So yes, I don't do it. I don't do laser. And whilst we have got an electrosurgery device, I would use a knife to cut it off, and then I'd use the electrosurgery to cauterize the little blood vessels personally. But it'd be perfectly reasonable to use a cautery to take it off, or a laser to take it off. They all do the same thing, Sam Vigilante. I think you've got to be careful if someone says to you, "I got this thing, it's brilliant, it's really good, it doesn't leave scars, fantastic. Why don't we all use that?" But electrosurgery, laser, is just delivering energy to the tissues and destroying the tissues or cutting it. Certainly, something like a CO2 laser is basically cutting it like a knife would cut it, but using laser energy to do that, to sort of burn the tissues, really. Same with electrosurgery, does the same. And they're all reasonable ways of doing it. Reasonable, yes, they are. Bumpy Girl, sometimes implants stretch the areola, so you might want it reduced during an uplift areola. Yes, Bumpy Girl. It's variable. I never really had it stretch that much, to be honest, the areola, but it can make it a bit more tense, yeah, when you do when you put implants in. And it would be part of the procedure to reduce it, having a lift anyway. You're welcome, Sad Vigilante. Hope I've answered your question. And if you're having electrosurgery to remove your fibrous papule, I'm sure that'll be fine. So I'm sure that's a very reasonable thing to do and a very reasonable course to take. And good luck with it. But yes, yes, sometimes the areolas stretch, yes, and areola and an uplift. An uplift is an integral part of an uplift, is an areola reduction, integral part. Clare Elisabeth, when you start to do G operations, will you still have a time restriction? Any idea on Mummy Make? Claire, you're asking the questions I've already got here. That was my next question. When you start to do GE operations, will you still have a time restriction? Any idea on when, Mummy? I tell you what, Claire, this is all a bit of a headache, isn't it? I've got to be honest with you. Life is hard enough, honestly. This surgery and seeing patients and trying to work out, what to do to them, and it's hard. It's not easy. But to have this other thing with the hospitals not letting us do surgery. Now, I understand the NHS stuff, but even with the private stuff, they're saying they're not doing plastic surgery. But anyway, but that's a separate question. So basically, you say when you start to do GA operations, hopefully that'll be soon, Claire, because GA operations have resumed. And so when we start, if we start today or tomorrow, or not today, a bit late to start today, tomorrow, yeah, or if we start whenever, yes, we've got a time restriction. And that was one of my questions, is why do we have a time restriction? Is it this mic? Why do we have a time restriction on surgery at the moment? And we have a time restriction of 3 hours. So it's 3 hours is the thing. So mummy makeover, which is usually an abdominal procedure and a breast procedure, is not advisable at the moment, because usually a tummy tuck takes 2.5, maybe 3 hours on its own. So if you combine it with breast surgery, it's going to be longer than 3 hours. So we're not allowed to do. I don't know why I'm yawning. I've been doing virtual consultations all day. I've just been on the phone. I've got my note. I haven't written up my notes. I've written them up. Anyway, so yes, the reason for that is, Claire, the reason for the 3 hour ting is that there was a paper that came out of China a while ago that suggested that there was a group of people who had surgery who then went on to get COVID-19, and they had worse outcomes than people who hadn't had surgery. And they looked at these people and they found that these people were mainly ASA 3-4, which is sort of slightly more higher risk of surgery. That's an anesthetic grading, means you've got comorbidities, and bigger operations, basically. So what they're saying is if you have a bigger operation and then you develop COVID, you're going to have a worse outcome than if you hadn't had that operation. Therefore, we shouldn't be doing bigger operations. Therefore, we're not doing operations over 3 hours. So I don't know what's going to happen. I'm assuming, Claire, that at some point we will be able to do surgery over 3 hours. At some point, mummy makers will be back, because I've spoken to 2 people today, I think, who want the surgery, and one of them was very keen to have both done at the same time, and so he's going to wait. So I've said it'll probably be next year. I've got to be honest with you, I'm plucking these figures out of my head. I've got no basis of fact for when we'll be able to do longer surgery, but I'm just guessing that maybe by next year we'll be able to do them. I don't know how things are going to pan out. Are we going to lock down again? Are we not going to lock down? Are we going to go back to normal? So it's hard to know how things are going to pan out. But all I can tell you is that right now we're not able to do operations over 3 hours. I can't see anything on the horizon, but in my experience, sometimes things happen quite quickly. Like the Spain, and you got a quarantine. One day they say that's the rule, so the rules can change quite quickly. So maybe tomorrow they'll say, "Oh, forget the 3 hour thing. That's all of red herring. You're all fine with it." But I suspect it probably will be next year. So if you do want a mummy makeover, if you do want them both in one go, I would say to you, it's probably not going to be this year. So if you wanted something done this year, you'd have to have one and then the other. You'd have to have one of them, tummy or the breast, and then the other one. What's going on here? Thanks. I gave a question. If I may, please I have a question. Yes, you may, Bumpy Gal. I was wondering if you felt comfortable turning a patient during a tummy tuck to do 360-degree lipo to backs, flanks, and bra line, please. So disappointing the NHS isn't releasing private hospitals. So am I. Is the 3 hour rule national? I believe it is, Bumpy Girl. I don't know though. The thing is, it's not a rule. It's a guidance. So it's guidance, and so yeah, and it's national. Yes, I believe it's national guidance. I think it is. Yeah. Would I feel comfortable turning a patient? Two things, Bumpy Girl. Would I feel comfortable versus would it be a good thing to do? I don't think it'd be a good thing to do, Bumpy Girl. Turning it to do 360, maybe to get. I get a little bit around the back. If you got a lot around your back, Bumpy Girl, I would say maybe a 360-degree tummy tuck. A circumferential tummy tuck, which really addresses not only the back but the sides. But if you've got a lot of fat on the back, so what I would do at best, maybe a bit of turning to try and get around to the flanks. In fact, I always try and get around to the flanks. So to the hips and flanks is this area here. Oh, let me demonstrate. It's this area. So when you're lying on the operating table, can you see? Oh, okay. Get rid of that question. Yeah, this area here. That's the area you get with that's what I routinely do with the tummy tuck. I get that bit. So I get you're up to there. How far do you want to go? I don't go back to the central back. So I just don't think it'd be worth it to get to that little bit extra at the central back to turn you, personally. So no, not a lot, just access to the flanks. Yeah, your flanks you can get when you're lying on your back. So yeah, I probably wouldn't really feel like it'd be worth turning all the way. Personally, on a personal level. God, look, hold on a minute. When can we do GA procedures? Done that. When do you do areola reduction? Done that. Why can't you do a mummy makeovers? Done that. Oh, I've done them all. I've only gone and done them all, haven't I? I've only gone and done them all. I've done them all. Right. Okay. Not a problem. Okay, not all surgeons do this, so it's good news. You routinely reach around the flanks. Yeah, well, not all surgeons would do lipo, maybe, but I think if you're doing lipo, it's hips and flanks is the lipo. Is that not routine? I'd have thought that would be routine, but yeah, hips and flanks, Bumpy Goal, is where I do the lipo. Try and get around the sides a bit. Oh, Olivia's in. What we got? I got a question. If there is a price agreed for 2 procedures and it's cheaper to combine the surgery because of this ongoing rule about 3 hours, would it then be possible to do 2 surgeries, but for say half the price? So splitting the price in 2, then say a thigh lift can happen way sooner. No, Olivia. So Olivia, the price is cheaper if you see, oh, you said that it's cheaper to combine the surgery, correct? So no, you can't split it. If you, the reason it's cheaper to combine the surgery is because you have one stay in hospital, you have one a pack, you know, one set of instruments, one lot of anesthetic drugs. So there's economies there. If you split the surgery in two and had it in two different times, you wouldn't have those economies of the one hospital stay, one anesthetic pack, or one instrument pack, and etc. So yeah, it wouldn't be splitting it in two. It would be back to what the normal price would be. And if anything, Olivia, anyone who's got a price, that price will stay the same. But the problem with the economics of all this is we're doing less procedures in the same amount of time because of all the distancing and all the theatre prep and theatre clean. So theatres aren't efficient because we've got a lot of time between cases. So there's only one way the prices are going to go. You know what I'm saying? Because in order to remain profitable, if they were profitable before, their margins have been reduced because they're doing less operations. But yeah, if you're, it's a shame if you want to have one and go, because you do get economy of price and economy of recovery, and it will be a bit galling to have to split it if you didn't want to split it. But it is what it is, Olivia, and we are where we are, and it's not good by any man's standards. No one's happy about it. Emma Victoria, when are you hoping to return to face-to-face consultation? Now, Emma, it's happening. It's happening. Face-to-face consultations. I did some, whatever day it is today. I don't know. Did I do some? Yes, I did. I did some yesterday. I'm doing them every day, Emma. Well, maybe not every day because I didn't do any today, but most days. I'm working my fingers to the bone, to be honest with you, Emma. I'm flat out. No, it is busy at the clinic. It's very busy at the clinic. Thank goodness. Thank goodness we've got the clinic. Thank goodness we're able to see patients and do minor procedures. You know, so that is very good. So yeah, we're open. We've got all sorts of bits and bobs going on. So we've all got face masks on, shoe coverings, and there's questionnaires to fill in, etc., etc. But they are going on. So it's so depressing. Tuesday today. Yeah. So yeah, we're doing it. It's real. It's live. So speak now or forever hold your proverbials. Any more, or Rodney? Really sorry about the Facebook issues. Goodness knows what happened there. Good, Emma. Look forward to seeing you. As I say, you can book online or you can give us a ring. 0121 454 3680 is the number. And you know what I meant to say at the beginning about YouTube, and we've got a YouTube channel. And I'll say it now. We've got a YouTube channel. So if you want to, what's the word? Subscribe, is it? Yeah, subscribe. That was a bit half-hearted, wasn't it? Sorry. It's really good though. There's loads of stuff on it. Oh dear, I have to work on my pitch. Anyway, good. Thank you all for listening. Thank you all for being here. Please ask away if you've got any questions last minute. I think I have got a couple of minutes. Yes, I have. No? Okay. Right. Okay. So on that note, good evening. Wish you good evening. I'm going to have a lie down because I'll tell you what, these phone calls are wearing me out. And I'll speak to you this time, 7 o'clock, same time, same place. And I will see you there. Got any questions, feel free to post them. Bye, Bumpy Girl. Olivia's going to ring the clinic. Excellent. And I'll see you next week. Bye.